Okay, I will just read something I wrote from bootcamp. Just some notes, not a lot. So, by 18 months, the children should speak more than 10 words. And the newborns with TGA, PGE1 maintains a pattern ductus arteriosus to circulate oxygenated blood for survival. Wearing splints on affected joints during sleep can prevent contractures. Less than 4 years old, the children should not use pseudoepinephrine. It's a kind of nasal congestion. And the children less than 4 years old, they must be controlled using non-pharmacologic methods like normal saline drops and bulb suctioning. Okay. Indomethacin can cause PDA. What will increase the chance to have breast cancer? If the mom is more than 50 years old, or the first degree relative like a mom's or sister, or even she was using vagina ring, because vagina ring might have some kind of estrogen or progesterone will release in the bloodstream, so it might cause breast cancer because breast is very sensitive to hormone. The birth control or CP will offer protection against endometrial and ovarian cancer. The patient who got burned, they should not use intramuscular or subcutaneous painkiller because the muscle area it got burned, it cannot absorb medicine so efficiently like being intact. So they should not use intramuscular or subcutaneous. The nurse should always prime any tubing before connecting it to the patient. The nurse should always prime first. Prime the tubing to get out the air inside of the tube, then connect it to the patient. The caustic substance is the chemical that will burn or damage tissue, like bleach or cleaner, any kind of cleaner. So if the person accidentally drank the cleaner, the nurse might need to prepare endo or prepare to intubate the patient because the larynx will get edema or swollen very fast. So if you suspect the person has drank the caustic substance, the nurse should prepare for the endo or intubation in case the airway will be all constructed and will be occluded. Then it will be too late for you to take action after it got so constricted. Emotion liability is a kind of sudden and extreme mood swings, like fluctuated mood, or very fluctuating. The cottage cheese is very high in protein, so cottage cheese is very good for dumping syndrome clients, and strawberry is also very good for dumping syndrome clients. And also like oatmeal, potato, because both of those are complex carbohydrates. It's not simple one, so it will take a lot longer to digest the oatmeal and potato. And egg, because egg is very high in protein, so it also will be very good for the patient who has dumping syndrome. And the feeling of pins and needles means paresthesia or numbness and tingling. When the woman got pregnant, the immune system will get suppressed. So the pregnant women tend to have immunosuppression. So the chance for pregnant women of having HPV and cervical dysplasia, the risk will be far increased because the immune system is being compressed, it's being depressed during pregnancy. So the chance of you having the HPV and cervical dysplasia, the cervical area will grow some abnormal cells. So need to be careful. Yeast infection won't increase the chance of having cervical cancer. So if you have yeast infection, don't need to worry about having cervical cancer because the risk is fairly low. PLCS, duodenum, increases risk of endometrial cancer, but not cervical cancer. So, like me, I have POCS. It will make me to have higher chance to have endometrial cancer, but I won't have cervical cancer. If you are taking birth control OCP and if you are multiparity, like multiple pregnancies, it will make you to expose under estrogen more. So it will make you to have higher chance to have cervical cancer because OCP is made of hormone like estrogen and progesterone. And when you are pregnant, the hormone in the body fluctuated. It's sometimes get very high, sometimes get very low. It's very dramatic. The hormone changes inside of your body. So it will make you to have higher chance to have cervical cancer because you are under influence of estrogen. And point of care means you do it at the bedside. You don't ask the patient to go to the examining room. You just do it at the bedside right away. Also because maybe the patient just had a very major surgeries and you don't want to risk the patient to walk so far, or maybe the patient got very severe fracture. So you just want to stabilize the patient in the location. So just do point of care. Psyllium. Psyllium is a very high fiber substance. It's a neutral fiber supplement. It's for the patient who has constipation. It's good. Psyllium. Flare-ups means sudden worsening of symptoms of a disease. Intake of saturated fats, like from cheese or red meat, will contribute to the development of fatty streaks. Fatty streaks is usually bad lipid. So if you take too much saturated fat, like in a cheese or a red meat, it will make you to have the higher chance to have the plaque being built up in a vessel. So it will make you to have fatty streaks. Parkland formula is 4 cc times TBSA times body weight in kilogram. So it's like 4 times how much the body was burned, how much percent, times 50 kilograms. Then it will be the amount of fluid you should transfer to the patients in 24 hours, like a normosterone or lactate ringer. And after the patient underwent thyroidectomy, the voice hoarseness is fairly expected for the first 3 to 4 days after surgery because the larynx is swollen, a little bit swollen, and edema there. So our voice hoarseness is expected. OA is a kind of arthritis. It's related to morning stiffness, and it usually resolves shortly after walking. Like after you walk for 20 or 30 minutes, the OA, the symptom will get relieved, especially the morning stiffness. And usually it's not symmetrical joints. Like if it's rheumatoid arthritis, it might infect both extremities because it's autoimmune disease, and autoimmune disease will make you to have the systemic change. But OA usually sometimes maybe you just stand on one foot, maybe. So maybe only your left leg or maybe right leg got more body weight bearing, so maybe only one part of your body got affected. So it's usually not symmetrical. Yeah, so when the question shows the body joints end with S, if infected, it impacted the joints and ended S, it means plural. When it comes to plural, it usually means RA, rheumatoid arthritis. HPV is viral infection because HPV, but PID, pelvic inflammatory disease, is caused by bacteria like gonorrhea and chlamydia. So PID is not caused by HPV, and HPV won't cause PID. Addison disease, because it's the opposite of Cushing disease. Addison disease will make almost everything going down. So you need to add steroid. And because Addison disease will make you to have almost everything going down except for potassium. In Addison disease clans, the potassium will go way up. So they should carry glucose gel because they will have hypoglycemia. So you need to give them more sugar to increase the blood sugar. RUQ, right upper quadrant, you can see the cholecystitis, because usually the bile duct is behind the liver, and liver is in the right upper quadrant. So cholecystitis is usually found in the right upper quadrant. Patients with acute kidney injury is at risk for fluid volume overload. So you need to monitor for signs of edema, especially like pulmonary edema. It will make you to have the crackle sound in the lungs. And also you need to monitor the electrolytes in the acute kidney injury patient, because they will make the potassium also goes very high, and once the potassium is so high, it will make you to have higher chance to have ventricular tachycardia or dysrhythmia. And the patient once has palpitation, you also might need to be careful, because it's a kind of dysrhythmia. The immediate treatment for any pulseless. Pulseless means there's no palpable pulse. When you palpate the place, you cannot sense any pulse. If you encounter the patient with pulseless rhythm, you need to do chest compression right away to maintain organ perfusion. And once you see the COPD patient has reversing respiratory acidosis, respiratory acidosis usually means there's too much carbon dioxide in your body. So once there's too much carbon dioxide in your body, it means hypercapnia. So the carbon dioxide is more than 45 usually, because the normal range is 35 to 45. The priority intervention is to use BiPAP. It has another name called NPPV. It's a non-invasive positive airway pressure ventilation. And when you see a children who has intussusception, usually when the client has intussusception, they will have the jelly stool, and you need to do air enema, 空气灌肠. Vomiting and restlessness can indicate the myocardial infarction in young children. So when you see young children who is vomiting and feeling so restless, it might indicate myocardial infarction, because when you have myocardial infarction, there's not so much blood being pumped out in the body, so it might cause hypoxia. Hypoxia will make you to feel restless and vomiting, because it relates to like abdomen might feel painful, so they might have vomiting. And tardiness is being late. Tardiness is not acceptable at work. So sometimes I also search the terms. Maybe it's very useful in daily life. I don't just write the notes. It's only related to medical. No, I also write some or search some terms that are very related to daily life, because I also have another exam, not just NCLEX. Tetanus vaccines are recommended every 10 years. Clients with egg allergies still should receive influenza vaccines. A one-time shingles vaccine is recommended for clients who are more than 50 years or older. Even maybe they had chickenpox vaccine when they were young, or they had ever contracted chickenpox when they were young, but once they are more than 50 years old or older, a one-time shingle vaccine is still recommended. In newborn, hypothermia can cause hypoglycemia, and hypoglycemia is usually caused by cold stress, and it will make the infant to have the seizure and respiratory distress. So if the infant has a very low temperature, you need to be careful, because like us, once you feel so cold, you will shake. Once you shake, your muscle is being contracted, right? If your muscle is being contracted so often, it will burn calorie, so it will make you to have hypoglycemia. Once you have hypoglycemia, the infant will have a seizure or respiratory distress. So it's very critical to treat the infant with hypothermia and hypoglycemia. Soft wrist restraints with quick release nut. 2 fingers width between the restraints and the skin. 2 finger width. Quick release nuts secure to the bed frame, not side rails. It must need to be secured at bed frames. Hypokalemia might be causing premature ventricular contractions or ventricular tachycardia. If too many premature ventricular contraction might cause ventricular tachycardia, or polymorphic torsade points will also cause ventricular tachycardia. So if the patient who is having very low magnesium and very low calcium, like hypocalcemia and hypomagnesia, you need to be careful because it's very potent. It will have very high impact on the cardiac muscle. So if the patient who has hypocalcemia and hypomagnesia, they might have a dysrhythmia, so you need to be careful. Newborn grunting can indicate respiratory distress. Also intercostal retraction. Nasal flaring also means respiratory distress. And like what I said, if it's too cold stress will make the body shake. Once the body shake, they will burn calorie. They will have hypoglycemia, and they will have seizure and respiratory distress. Peritoneal care should be performed twice per shift with soap and water. And UAP can perform peritoneal care, so the nurse can delegate the UAP to perform the peritoneal care on patients. Clamping urinary catheter for more than 15 minutes will cause the urine to back up, and it will make the patient to have higher chance to have infection. So if you see the answer has clamping the urinary catheter for 20 or 30 minutes, it's wrong. Don't do that for more than 15 minutes because they will have infection. Urinary bag should not be more than halfway full, and it will need to be always under. It cannot be higher. No way. It cannot be put on the bed. No, it needs to be lower. And elevated TSH means hypothyroidism. So Graves' disease will have decreased TSH. Graves' disease will not have increased TSH. They will have decreased TSH. Cognitive behavioral therapy focuses on restricting the current thought and behavior. Psychoanalytic therapy, because it will analyze anything from the past. So psychoanalytic therapy focuses on analyzing a person's past experiences. If the pregnant mom is using methadone during breastfeeding, it's allowed. But once the pregnant mother, the baby is still in the belly, you shouldn't use methadone. But once the baby is delivered, you can use methadone. PICC is necessary for long-term antibiotic therapy. Cough suppressants, for example, dextromethorphan, may dry and thicken. Once it dry, the respiratory secretion will be thickened and should be avoided in children less than 4 years old. In the first 2 weeks of life, newborns may lose and regain up to 10% of their birth weight. Also, it might take like 48 hours for the newborn to pass meconium. So if the answer said the newborn didn't pass the meconium for like 12 hours, will it be a priority? No, because you can wait for 48 hours at most, 2 days. Rugs and floor runners will increase the risk of having fall. So throw rugs and floor runners are avoided, especially in elderly place, because they might have higher chance to have fall. Once they fell down, it will have a very high chance for them to have a fracture. Yeah. Okay, and it reminds me, when the women experience menopause, the estrogen level will go down. So after the women have menopause, they will have very high chance to have osteoporosis. So once they fall down, it will have very high chance for them to have a femoral fracture. And the estrogen and progesterone will also help to maintain the airway pattern. So once the women also experience the menopause, they will also have higher chance to have the sleep apnea, like the obese patients, and the neck circumference is a bit larger than normal, and after menopause, you will hear them to have the snoring during sleep more, because the airway is not as patterned as before, because the estrogen and progesterone will make your airway to be patterned. Imposter is someone who pretends to be someone else to deceive people. Instead, like naproxen ibuprofen will increase the risk for myocardial infarction and stroke. So when the patient has myocardial infarction and stroke, they can still use aspirin. They can use aspirin, but they cannot use other NSAIDs like naproxen and ibuprofen. Okay, then reduce liability means to lower the risk of being responsible for something bad happening, or need to pay for something for the damages. So reduce liability is to make yourself to have less legally and financially responsible, and avoid getting in trouble or paying money if something going wrong. SSRI, for example, fluoxetine, the medicine ends with statin. Sertraline, citalopram, is for depression and anxiety. They can cause potentially fatal condition like muscle rigidity. Once it got so rigid, it will make you to have spasm, muscle spasm. And if it's so spastic, it will make you to have fever because it's so tense. So you might need to use cooling blankets on those patients and anticonvulsants to make the spasm less severe. And those SSRI usually will cause diarrhea and nausea. The fluoxetine, sertraline, citalopram will make the patient usually to have diarrhea and nausea, but clomipramine and amitriptyline will cause you to have urinary retention and constipation, because clomipramine and amitriptyline are anticholinergic, and they will make your body very dry, like blurred vision, constipation, urinary retention, dry mouth, so they can suck on hard candy, they can chewing gum. Yeah. MAOI, like selegiline and isocarbazole, needs to avoid like theramine containing foods like aged cheese, beer, and wine. and chocolate. Radical hysterectomy removes more, including the ovaries, to treat cancer. Total hysterectomy removes the uterus and cervix, just that part, so they will keep ovaries in place. So total hysterectomy, they will have menopause later, because they still have ovaries. It can produce hormones. Due to the potential for extravasation, the norepinephrine should be administered through the central venous access device rather than the peripheral venous access device. Norepinephrine is very caustic, and it's a kind of vasculant. So you need to be very careful and only used through the central venous access, like subclavian. Unless it's emergencies, otherwise only central venous access. HSV requires contact precaution. Contact precaution, because it's through direct contact with infected lesions or body fluids. Rigor is sudden intense chills with shivering. It's a very serious fever, often happen with fever and infection. Modified vaccine schedule is for patients with immunosuppression, like AIDS. Because sometimes when they are sick, they are not supposed to have vaccine, so they need to have modified vaccine schedule, especially for the people who have immunosuppression. But cystic fibrosis is not immunosuppressed, so they should just get vaccine on time according to the schedule. Not modified, because modified means not being on time, and you need to modify and change the timing. Lyme's disease is caused by deer tick bite. And the people should wear light colored, not dark, light colored, because the tick can see the light colored more easily, so they will run away faster. The walker handbar should sit just below the client's waist. Don't too high, don't too low, just sit below the client's waist. If the patient is allergic to avocado, kiwi, banana, chestnuts, because lactose, like glove, condom, catheter, even endo, they are all made of lactose. So if the patient is allergic to avocado, kiwi, chestnuts, banana, the nurse should call the surgical units before surgery, because they might need to use other stuff. They are not composed of lactose. Once the GDN moms deliver, the blood glucose would become normal. So if the GDN mom deliver the baby, maybe the glucose will become normal. So if the moms say that it's right, don't correct them. Don't give them more education, because it's right. Angioedema is a very severe side effect of ACEI, because it will make your lip, make your face, make your larynx swollen. And once it got swollen, you cannot breathe. So it's a very serious side effect of ACEI. For anorexia nervosa patients, the weekly weight gain is only 2 to 3 pounds, not more than 5. 5 for a week is too much. But if the monthly weight gain is 5 pounds, it will be okay because it's not a lot. But for 1 week, it's never be more than 2 to 3 pounds. It's better to just get 2 to 3 pounds a week. So if you are having your babies to sleep at your room, you need to move the baby's changing table across the room from the crib. It means you need to move the baby's changing table on the other side of the room from the crib. The troubleshoot dampened waveform. How to deal with the dampened waveform? You need to flush or re-zero the line. Leveling the transducer with the EAC. External auditory canal will be appropriate in ICP monitoring. Film badges when you take care of the patient who is under radiation, especially the internal radiation, the brachytherapy. The film badge is only for personal use. It cannot be passed on to the nurse for the next shift. So it's only used to monitor individual staff members' radiation exposure and cannot be shared with other caregivers. It's only for personal use, like pets. If the pregnant mother is having placenta previa, because the placenta is lying just a little bit above the cervix, so when it's just cover the cervical cervix, you shouldn't do the cervical dilation. You shouldn't assess the cervical dilation and effacements. You just use an ultrasound. You can visualize the placental location when necessary. Hepatitis B positive mom after the delivery, the newborn will need a bath right away to wash out the contagious fluid. Non-blanchable redness is quite severe. You usually find the stage 1 pressure injury to have the non-blanchable redness. Knee to chest position is for cyanotic episodes. Knee to chest is only for cyanotic, it's not for acyanotic. Recent vaccination might put the clients at a risk of GB syndrome. GB syndrome is the ascending process of paralysis. So if you have recent vaccination, you will have the higher chance to have GB syndrome. And it's quite scary because in the end, the patient who has GB syndrome will have the respiratory failure because the diaphragm cannot function properly anymore. So very serious. Positioning the client's supine. You need to put the clients on their back for effective fundal massage. When the fundus is very bulgy and very soft, you need to do the fundal massage. You should put the client's supine, not prone position, supine, so you can massage here easier. When you are doing the perineal care, or if you are doing the catheter for the women, you should put the clients supine and dorsal recumbent position. It's just to flex your legs. But it's called dorsal recumbent. After the client has experienced MI, dual antiplatelet therapy (DAPT) with both aspirin and P2Y12 inhibitor like ticagrelor and clopidogrel is taken for at least 6 months to a year to reduce the risk of coronary stenosis. COPD is an inflammatory disease must be treated with steroid because steroid can make the swollen less serious. So once the COPD patients need a treatment, they should use steroid. Pertussis is a very highly contagious bacterial infection. It's not virus. So pertussis will not cause bronchoconstriction. So pertussis patient, they don't need to use albuterol. Albuterol is used for patient who has asthma and COPD. It's not for pertussis. Once the client has stroke-like symptoms, obtaining blood glucose is important. So if you see, maybe the patient has one side drooling, paralysis on the face, and the arm is stripped, you should get the patient to check their blood glucose as soon as possible. Because sometimes hypoglycemia can also cause the patient to have the stroke-like symptom. Halitosis is bad breath. Breath that smells unpleasant when it comes out of mouth. After ear surgery, for example like myringotomy, change ear packing daily. Avoid drinking via straw. Once you have the surgery here, you shouldn't drink anything through straw because it will cause you to have increased cranial pressure. It will impair the healing of your ear. So if you underwent myringotomy, you shouldn't drink anything through straw. When you are not eating, when the client is not eating, the client with DM should still take metformin because metformin is not very potent. So if the client is NPO, you should still administer metformin, but the sulfonylureas, for example like glimepiride, you should stop, you should hold, you should withhold because it will really increase the production of insulin. Once the production insulin is increased, it will make your blood sugar really drop very fast. So you need to stop taking the sulfonylureas and glimepiride. Metformin, once, even if you are NPO, if you are under NPO, you should still take metformin. Angle closure glaucoma should be administered alpha adrenergic agonist like agonist eye drop, like apraclonidine, to decrease the aqueous humor production. Because glaucoma is increased ocular pressure inside of your eyes, means there's too much liquid being produced inside of your eyes, so you need to decrease the production of that. You need to use the alpha adrenergic agonist eye drop like apraclonidine to decrease that. And in what kind of condition you need to apply eye patch? It's usually only used after the patient undergo the retinal detachments. So after you fix the patient with retinal detachment, you should apply eye patch. Lashing out is suddenly experiencing anger towards somebody, often in words or actions. It means you are so angry, so you are lashing out. When suspecting the patient has acute kidney injury, urine analysis is required. So you see, maybe the patient is having acute kidney injury. Usually the potassium is also very high. You need to avoid the food is containing lots of potassium. And also you need to do the urine analysis to check the components in the urine. So then, if the patient has the CVP or they had the dialysis, you suspect patient has the air embolism, you should position the patients in the left Trendelenburg position. But if the patient has fat embolism, you cannot position the patient in left Trendelenburg position. The reason why you should position the patient in Trendelenburg position when they have air embolism is because you want to trap the air in the right atrium and don't let the air coming out, so you should do that. Rogaine is given through IM. Breastfeeding plans require an additional 450 to 500 calories a day. Not 200. 200 is too little. If you are breastfeeding your kids, it burns a lot of energy. It burns a lot of calorie. So the daily calorie should be increased like 440 to 500, not 200. Benzodiazepine, lorazepam should be avoided in older adults. Benz is like the car, it's so fast. Older adult would be so scared to be on Benz. So benzodiazepine, lorazepam should be avoided in older adults, as older adults metabolize this medicine a lot more slowly, and it will increase sedation, and it will also make your respiratory depression, and it will impair your cognitive function, increasing the risk of having delirium and fall. After repair of the retinal detachment, not just giving them the eye patch, you also need to let them to sleep on their stomach. It's also called prone position. Don't let them to do side lying. Never supine them. Never let them to sleep on the back. Okay. If the patient who underwent retinal detachment, you need to apply eye patch. Also let them to sleep on the stomach. This part is on the bed. Don't supine. Don't sleep on their back. Don't look at the ceiling. No, they need to look at the pillow instead of look at the ceiling. Okay? Allopurinol should be taken with meals to minimize nausea, vomiting, and diarrhea. Any kind of medicine will make you to have nauseous, vomiting, and diarrhea. It should be usually taken with meals, like penicillin. So, if someone's toxicity screen has remained negative for the last year, it shows he has stayed drug-free whole last year, because the toxicity screen is negative. Negative means nothing can be found. So it means he didn't use drug last year. He was drug-free last year. Vasopressor receptor antagonist, it can it can be function as the diuretic. It will block ADH activity, so it will make you pee. The medicine is called conivaptan. Conivaptan, they will block ADH activity and promote diuresis without losing too much sodium. So because furosemide diuretics should be used in SIADH when the sodium is more than 125. If the client has very severe hyponatremia, they shouldn't use furosemide because furosemide will also make your sodium dose too fast. And once the patient has hyponatremia, they will have a very high chance to have cerebral edema. And once they have cerebral edema, they will have very high chance to have seizure. But conivaptan, they will make you to have diuresis also, but they won't make your blood sodium to be decreased too fast. So it's better. It will not make you to have cerebral edema too fast. Yeah. The small percent ADH is used for diabetes insipidus. Euglycemic means stable, normal blood sugar. So if you see U, start with U, it means normal and stable, even for blood pressure. Zolpidem can treat insomnia, but zolpidem will also make you to have sleepwalking. Aciclovir is safe to take during pregnancy, so if the pregnant mother is having the herpes, they should still take aciclovir actually every day, every single day. They need to take that, so it's safe to take during pregnancy. Once you think the client has many boyfriend or girlfriend, multiple partners, IUD is not recommended. Baby with pyloric stenosis, because there's hypertrophy stenosis in the pylori area, so they will throw up very often. But once they throw up, they still want to eat. So the baby with pyloric stenosis, they will still maintain their appetite despite vomiting. They still want to eat again right after they throw up, okay? Retinal detachment usually happens to older adults, not children. Usually children will not have retinal detachment. A client experiencing placental abruption usually requires cesarean section and needs to be NPO. Once you are having surgery, you should usually be NPO, especially when the patient is experiencing placental abruption. Also, you shouldn't use oxytocin in every pregnant woman. You only need to use oxytocin when they are doing birth naturally, when they are giving birth naturally, like through vagina. But if you are doing cesarean section, you shouldn't need to use oxytocin, which is also called pitocin. Alendronate should be taken in the morning or an empty stomach. For newborns whose shoulder cannot pass through pelvic inlets, it's also called turtle sign. The nurse should hyperflex. Hyperflex make them legs closer to you, not hyperextend, because it will make the baby to come out easier. So it can strengthen the sacrum. It's also called McRoberts maneuver, and applies suprapubic pressure to dislodge the shoulder. When the pregnant mother is having the turtle sign, the baby's shoulder cannot pass. It's also called shoulder dystocia. You shouldn't use oxytocin, because it's not related to the contraction of uterus. It's related to the shoulder cannot be passed through. Bedpans. Wider curved end is directed toward the head of the bed. The wider curved end is directed toward the head of the bed. A pneumothorax will make your to have the intrasthoracic pressure to become higher, so it will cause obstructive shock. Elevated TSH means hypothyroidism, I said before, and also Graves' disease will have lower TSH. Acute respiratory distress syndrome will make you have tachypnea and dyspnea. An additional dose of naloxone could reverse the central nervous system and respiratory depression. Because opioids will make you to have central nervous system depressed and respiratory depressed, so you need to use naloxone. But the half-life of naloxone is so short. It's only like 30 minutes, and the effect of opioids is a lot longer. So repeat dose of naloxone, also called Narcan, are sometimes necessary because the effect of opioids lasts longer than the effects of the naloxone. The most common and earliest finding of carbon monoxide poisoning is a throbbing frontal headache. So if this part is so painful and it's throbbing because the vessel is being so dilated, you might need to suspect the patient is having carbon monoxide poison. Headaches are experienced in clients less than 26 gestation due to fatigue and hormone changes, but the persistent headache after 26 weeks gestation could mean gestational hypertension and preeclampsia. So if the pregnant mother are less than 26 gestation, if they have headache, don't be too surprised, don't be too shocked, because it's a normal finding. But if it's so persistent and the pregnant mother is already having like more than 26 gestation, then you need to be careful because it might be hypertension and preeclampsia. Type 1 DM has storage of insulin aspars. They should store the pre-filled syringes in an upright position. So with the needle pointed upward to prevent the needle from clotting. Tetracycline and doxycycline cannot be used during late pregnancy and breastfeeding because the tetracycline and doxycycline, they can pass through the breast canal, the breast ducts, or through the placenta and cause the permanent staining of the infant's teeth. Acute bronchitis is usually viral, so don't use antibiotics with the patient who has acute bronchitis, okay? Hypocalcemia can occur in acute pancreatitis, so the nurse should monitor for signs of tetany. +3 fetal station and the full dilation indicates the mom is going to deliver, so the nurse should notify the healthcare provider of the current assessments. Transdermal contraception should be applied each week for 3 consecutive weeks. So if the person is using contraceptive methods, especially the transdermal contraception, they need to be applied each week for 3 weeks in a row. Then the 4th week, don't apply because the girl should still have period. They need to have period. Widening postpartum pressure is more commonly associated with increased intracranial pressure, like Cushing triad. Like the difference between the SBP and DBP is too large. It's caused by increased intracranial pressure, and you will have the Cushing triad, and the widening post pressure is very large. I mean the SBP and the difference between the SBP and DBP. But Cushing triad will also make your heart rate and respiratory rate going down. It's only the post pressure is very wide. The St. John's wort can decrease the efficacy of birth control. Like the birth control sometimes will has ethanol in the man. So if the person like me is use birth control, I shouldn't take St. John's wort because I might get pregnant. Yeah, and I don't know because it can decrease the efficacy of OCP. Non-selective beta blocker, for example, propranolol, can prevent initial and recurrent variceal bleeding by reducing heart rate and portal venous pressure. So when the patient is having the liver cirrhosis, they might have increased heart rates and also very high pressure, blood pressure, portal venous pressure. So you want to prevent initial and recurrent variceal bleeding. The vessels around the esophagus is being dilated, and because the pressure of the liver is too much, so it will make too much blood accumulate here. And once it accumulates here, it's very easy to get rupture. So you might need to use propranolol to decrease this kind of chance. When caring for unresponsive, unstable trauma patient who needs emergency, we need to assume the client will consent if able and proceed with treatment. So once the patient is suddenly unresponsive and is so unstable, he is having very serious trauma, and you don't know if he will consent the procedure, just assume the person consents. Just do everything possible to save the patient. Don't wait for the informed consent. Don't. Just assume the patient agrees that. Intermittent lower abdominal pain can indicate possible preterm labor, like less than 37 weeks. So you should administer terbutaline to slow or stop preterm labor. Also, the medicine end with zipline can also stop labor. Mammograms are recommended after age 40. Phenylephrine spray for nasal congestion. Phenylephrine spray for nasal congestion because it looks like it's related to alpha. So the side effect is rebound congestion. And because it's related to alpha, so I assume it will be a kind of stimulant to your central venous system, central nervous system. Like it will make you to be nervous, and you might have insomnia, and you will be very irritable. And however, the nasal steroid will make you to have very dry and irritation. Amphetamine use can cause appetite suppression. So when the patient is using amphetamine, especially the psychiatric patient with ADHD, they need to use methylphenidate or amphetamine because their brains lack of stimulants. So when they use amphetamine, they will lose their appetite on eating. So they will have weight loss because the amphetamine decrease the appetite. GDM increases the risk for gestational hypertension because GDM it will make your vessel to be have more lipid. So once it get more lipid and it got thicker, you might have a higher chance to have the hypertension and preeclampsia. Because preeclampsia, you need to know the blood pressure will be like 140 over 90. So GDM will increase both hypertension and preeclampsia. Can't underwent gastric bypass surgery can lead to decreased ability to absorb vitamin B12 from food. So typically they will need to have the lifelong B12 supplementation. And B12 is usually only can be found in animal. So if the patient is on the vegan diets, they will have very high chance to have B12 deficiency. And once they have B12 deficiency, they might have the pernicious anemia. Once they have pernicious anemia, they will have glossitis. It's the inflammation of the tongue. But if the client is on vegan diet, do they need to really have the iron supplements? Actually, no. They might need to have the B12 supplements, but they might not need to have the iron supplements. Why? Because iron can also be found on beans or lentils. But B12 is basically impossible to be replaced by any other vegetarian food. And also when the patient underwent the bypass surgery, the one part of the stomach is being removed. The stomach is in charge of the intrinsic factor. Intrinsic factor is very related to B12. So once the stomach is being removed, the absorption of B12 is highly decreased. They need to have B12 supplementation. And between the secondary and primary hypothyroidism, secondary hypothyroidism will make the TSH, T3, and T4 going down, but primary hypothyroidism will make the TSH going up, the T3 and T4 going down. So primary hypothyroidism is also like Graves' disease. Just think Graves is the first, so he needs to be primary. It's an easier way to remember it, but I think it's quite difficult. I don't think NCLEX will test that, hopefully. If a newborn is born to a mother who had opioid abuse and is negative for illicit substance, like when you know the mom was so addicted to opioid, but you know the mom was not so addicted to like heroin or cocaine, you can still breastfeed the kids, because the kids after they are being born with the mom, from the mom who used a lot of opioid, they might suffer from the NAS. And the breast milk might still contain a little bit of opioid, so it can make the symptom be more alleviated. But if you know the mom was still using the heroin and cocaine, then you shouldn't do breastfeeding, okay? Only when you are very sure the mom was only addicted to opioid, then you can do the breastfeeding, otherwise don't. Dairy products like cheddar, string cheese, and yogurts are very good for the pregnancy because the protein and calcium are very high, but the pregnant mother should avoid like soft cheese, brie, and feta because they are not so solid, so you assume it's not as fresh or not as fresh as the cheddar, string cheese, and yogurt. So the pregnant mother shouldn't eat bread and feta because they might contain listeria bacteria. Listeria bacteria is usually found in milk, and usually many cheese, especially nowadays, are made of milk. Yeah, so you need to pasteurize the milk products before being sold to the people. So reasonable. If you give the pregnant mother the bread and feta, it might cause very serious pregnancy complications like miscarriage and preterm labor. Early sign of neurogenic shock. Early sign of neurogenic shock will cause your BP and heart rate to go down, and it will cause you to have warm and dry skin. So early sign of neurogenic shock is very different from the shock we usually know, like the hypovolemic shock. It's the you tachycardia and very cold and clammy skin. COPD is very related to the right heart failure. So when you see COPD, you need to connect it to right heart failure, like for example, core pulmonary. Okay.